Ebola and cholera is capturing the world's attention. The emergence of Ebola outbreak in Guinea, Sierra Leone and Liberia remains a serious public health concern. The Ebola virus spreads by direct contact with body fluids, such as the blood of an infected person or animal. Although the pace of Ebola transmission has slowed down in these countries, its threat continues to limit the ability of local healthcare systems to provide standard care, let alone respond to other health emergencies. The World Health Organization study confirmed that 70% of individuals infected with Ebola in the sub-region have died, a rate higher than previously reported. The infections are projected to triple to 20,000 if efforts to tackle the outbreak are not stepped up. Though the disease has not been confirmed in Ghana, over 20 suspected cases, all of which proved negative upon testing at Noguchi, has been recorded. Cholera, on the other hand, is a serious disease that occurs in epidemic proportions. It is spread mostly through water and food that has been contaminated with human feces containing bacteria and insufficiently cooked seafood. It has killed millions of people and continues to be a major health problem around the world. In 2015, 309 suspected cases of cholera were recorded, but only 70 were confirmed in Accra. The recent floods that occurred carried lots of filth to our doorsteps that has also reignited the outbreak of the disease. To this end, UK Aid identified Hope for Future Generations and two other organizations, namely Youth Development Research and Innovation Center and Institute for Social Research and Development, to embark on a nationwide behavior communication change project, with HFFG being the lead organization.
Hope for Future Generations and its implementing partners, UDRIC and ISRAD, are community-based NGOs. We are involved in this project because we believe that contributing to our national development should be the way we should all go. Ebola Cholera Communication Project is a very important project that the consortium is implementing. We believe that prevention is better than cure. And as we all know, Ebola is not yet in Ghana, and the government, development partners, civil society, everybody is putting in all efforts to ensure that Ebola doesn't come to this country. So as a consortium, we are also contributing our quota to the development of this country. And that is why we come together to implement this innovative behavior change communication project that build the capacity of community structures, inform them about the preventive strategies, and to make everybody alert to ensure that we don't get the disease. On cholera, a lot of people die annually through cholera. So what we are trying to do is to identify the agencies that contribute to cholera, to inform the community structures, to inform schools, everybody to know how to prevent cholera. And even if you get cholera, we prepare and educate them on steps to take to reach out to hospitals quickly, so that the health facility or the health nurses and doctors can prevent death as a result of cholera.
HFFG aims at promoting behavioral change, which will reduce the risk of transmission of Ebola, strengthen the capacity of community-level stakeholders on their preparedness in addressing Ebola prevention and case management in Ghana, by recruiting and training project staff and volunteers on the project goals, objectives and deliverables, addressing rumors and reduce panic, fear and stigmatization. The consortium working with women groups as caregivers of the sick and addressing key at-risk audience groups such as people who consume bat meat, antelopes, monkeys and other primates such as bushmeat, those who frequently travel across borders, those handling sick and the dead if outbreak occurs in Ghana.
ISRAD is excited to be part of this project of Ebola and cholera, and we are motivated by our own objective. That is, that is hinged on our desire to help the society, to help the community, to contribute to, ensuring that inhabitants of various communities benefit from various projects that we implement. So we all are aware about the epidemic of Ebola and then cholera. And cholera has been a particular condition that is associated with behavioral patterns. And we are convinced that influencing behaviors of persons and people are going to help in ensuring that the disease is not spread across board. Again, Ebola, as we are all aware, has been an epidemic across the world. In fact, it's a pandemic. And then it's a condition that can also be prevented by very good sanitary practices. And we think that behavioral change, for that matter, is something that's going to help in ensuring that the disease does not even come into the communities, let alone getting spread.
In view of this goal, interventions were put in place to effectively implement the project. For example, in 10 selected districts in the Volta region of Ghana, which shares border with Togo, where hunting is predominant. The mobilization campaign, which aimed at reaching schools and communities with informative messages on cholera and Ebola, was successful, as many myths and misconceptions were brought to light.
The awareness creation have made it that a lot of people are aware of the disease and the way it is being transmitted. And culturally, they are also saying that because during these festives, they shake hands and they greet people. But then when you go and then you meet an elderly person and then you wave their hand, it seems as if you don't respect the people. So some tend to say that they will not even go to the social gathering at all. In addressing these myths and challenges, a lot of health education and health promotion activities is being carried out in the district. About 20 volunteers had been trained in the district, and they also carried out these activities in their various communities, educating the people on the preventive measures. Because of the awareness, a lot of the Okada riders now, when the relations call them to carry dead bodies, they usually refuse because they are aware that the disease can be transmitted through the touch. And about 95% of the people now, when they want to eat or after visiting the toilet, they always wash their hands with soap. Unlike formerly, they just wash it in water and go, but they always want to wash it under running water with soap.
Project staff, together with trained community health volunteers, were trained to create awareness on the two diseases using the following methodology: house-to-house sensitization, group-level activities, example, churches, mosques, drivers, undertakers, etc., school sensitization, and community debates. In the Bono-Ahafo region, HFFG organized community outreach programs that embark on joint monitoring and supervision visits to stakeholders and affected communities, improve hygiene and sanitation behaviors among community members and the general public. Volunteers were selected based on communities close to the border due to the high risks involved in meeting cases from the nearby countries. Therefore, the training brought more representatives who were selected by the District Health Directorate to be trained.
Dear manya free scientity hope for future generation. Ademo amene ye kire me kwan a ye faso a obinya korora ye bebo ho ban ana se mpo ye mpese ye benya nti san kire na omode me fam no sa na me so me dinam e kire afoforo na ama enema so asesa ama se de na first ye hu nema no ye hu bi sa biem anse san ne bi ni se first no ka wo number bi a mfikire ba bi ne akola agya ne nan aguba bi basa de yare ne ba by nam sa anamo e start say ye tu ninti ne sa ne mo ne nyina no eto atwa hope for future generation enchereche o mo de be ma bia no mo ma onkrata enema wo so a wo de kire nipa na de a ohun no bibia kwan obefa so obeye we ade we ye ne sei ade we ye nye ne sei ti ema ye aboa ma adwuma no kra ye na akofo ma aye mre.
As a volunteer in the Salamba community, I have to move from house to house, even sometimes school to school, and then give them my little knowledge that I have with Ebola and cholera. In fact, we learned a lot of the Ebola and the cholera by taking us with Israel. They taught us everything, and they even helped us to go to the house to house and then sensitize them, including some of our women groups in the community.
HFFG also oriented Queen mothers in the Bono-Ahafo region on the goals and objectives of the project, and also supported them to identify areas within the project scope of work they can contribute to.
Adesua minye free hope for future generation and China. Megusua ya mede eye adwuma me nante bebre ko community mu ko kyerɛkyerɛ na kuro bia so amekoso no me ko kuro no mu ehemfo ho efiri sɛ yɛse odesua nko a akowadwane ne sa ahonti me ko ahemfo no ho ene omo kokasa sɛ ne ebenya simpie biara ohene ana ohema bia benya no ono so di asem no bebo dawuro no akọ yare to se Ebola ne de enya nuru ye Ghana mamu ha emeduru yesunwan mamu ha sei ne sa ho tie no ho bambo de masua na ma kyerɛkyerɛ me manfo ama omo de ato omo kotodwem firi se ye se wote se obi abogye se ehia esesa wonso sansuo na wodi si wodi ho na yale kwalela ne de ye ne nete enti ade ye fi bibi te say general cleaning twifo e be ka ne say abegyadwuma ye wo manhema e wo sunwane ne sa ho nti ye ne nananom nyina ka bom aboa ye manfo ano eni omo eprapra fin a ye wo yekuro mu eni ye nkuru ase.
Before Hope for Future Generation came and educate us in our school, at first me and my family, we always move around. We have toilet in our house, but we don't use it because that one you waste your time. Maybe someone will be there and you too, you want to do the thing. And you can't wait for that person, so you have to move around and get some place where no one can see you, and you ease yourself there. After that, you will not clean it, or you will not do anything with it. You just left it there. When the Hope for Future Generation came and educate us, me too, I sent the message to my brothers and sisters, and now we are practicing it. So we thank Hope for Future Generation for their educating.
We started this project by bringing together a team of development and health experts to look at proposals that we contacted development partners, including the UK-Aid. And UK-Aid shared in our vision in trying to bring these behavioral change approaches to the community. And they supported us with funding. We've deployed a number of strategies, including the use of local community volunteers, as well as engaging closely with the Ghana Health Service in ensuring that this particular project becomes a success. In summary, our motivation has been our desire to contribute to societal good, and we think that we have been successful as far as this particular objective is concerned.
Hope for Future Generations and its implementing partners are very grateful to UK-Aid for supporting us to implement this project. The project is very, very successful, and we are happy. Even though the project on paper is ended, we have put in a strategy that will continue educating the communities. That is why we have recruited so many environmental health officers and built their capacity as field officers, and they are living in the communities, and they will continue the implementation.
Behavior communication change is an ongoing process, using the existing structures and strengthening them. It is the hope of HFFG The communities will continue to spread the knowledge acquired on Ebola and cholera and replace the fear of the diseases with knowledge and skills acquired.